5 years ago, I had never even heard about VAERS. I had this weird and hard to pronounce acronym. When I first heard it, I couldn't even understand what people said. What is this, VAERS? No idea how to spell it. No idea what it stood for. Now it's 5 years later, and I think today many Americans do know what VAERS means. I don't know how many. Maybe it's even a majority of all Americans. Not sure. Welcome, Albert and Melanie.
Hi, Cornelia.
Hi, Cornelia. Thanks for having me.
Thank you for having us.
Well, thanks for coming on. I'm really excited about this session because we have, well, first of all, Melanie here, and I did an interview with her, a long interview about 2 or 3 months ago, Melanie? No, 2 months ago, I think.
Maybe.
And it got over 40,000 views on Rumble. The most ever, by the way, Melanie.
Thank you.
And she talks about the terrible harms that the 4 mRNA Moderna shots that she took did to her and how it devastated her health. And then, of course, Albert, who is famous because he really got into VAERS and what it is and how it functions and its shortcomings and how it does not do a great job of tracking what happens to people who were harmed by these vaccines. And he's a real expert on this. So I'm really excited to draw on all his knowledge and the incredible work he has been doing over the last, how many years, Albert? 4?
Yeah, since day one of the rollout. So December 14th, 2020, I've been on VAERS.
Since day one of the rollout. Wow. Yeah, impressive. So, Albert, let's start with you. How did that happen that you became a VAERS expert? And as you just said, from the first day of the rollout of the vaccine.
The world's expert.
World's expert.
Well, I'm a medical biller by profession. I've been doing medical billing for 25 years. And after that many years, my fancy title is a revenue cycle management expert. But I basically had, for a while, I had my own billing company. And then I worked for a diagnostic laboratory called Hunter Labs here in San Jose, California. And my boss, Chris Rydell, he won the 2011 Whistleblower of the Year against Quest and LabCorp for a Ketam whistleblower case. But anyways, it was like, up $240-something million. And I was running his billing operation for 10 years. So I had a lot of experience, even as, and then after that, I went to another company after he sold to BioReference Laboratory. Then I went to another MSO, which manages IPAs, independent physician associations. So I became an HMO claims auditor. So we're basically receiving insurance claims from physicians for reimbursement for services rendered already. So it's like I'm on the insurance side processing claims and deciding whether to reimburse, whether to pay them or not, or request for additional records, make sure, all the data is there from Stanford Hospital, which is here in my backyard, all the hospitals around here in Northern California. So I'm a real medical billing expert. And in that journey, I've myself personally have billed out thousands of insurance claims for reimbursements for the administrations of vaccines for my own providers. And so I was very familiar with the Vaccine for Children's program in Medicaid, which is like 40-60% of all the vaccines in the United States flow through that program because it's governmental and it's basically free. That's how people get their free vaccines, the kid vaccines. So anyways, I was really familiar with all of that stuff. However, I was only familiar with VAERS by just name alone, because if my providers had to submit a VAERS report, that didn't come through the billing department. So I wasn't a part of a submission process if and when that ever happened. I just knew the name of VAERS and what it was for and what it was about. And so, come December of 2020, I was wondering, I wasn't that naive, but I was wondering, I wonder if this shot's going to be any good. Warp speed, I wonder. I wasn't sure. I was like, well, I'll be the last in line to take it. I mean, I was still naive enough to say, well, there's a possibility I might get this jab. But I want, half the population to get the jab first and see how it goes. And so I jumped into the VAERS system, downloaded the raw data, and I realized, oh my gosh, this is like second nature. It's all the stuff I'm familiar with, the MEDRA codes, just the structure, the setup, everything, the names of the vaccines, all that stuff. So my main shtick is billing. And it's coding like ICD-10 codes and CPT codes, the data visualization and the Microsoft Excel skills and the dashboarding, the visualization. That's all just a small sliver of what my main shtick is. I needed all of that out of necessity to manage my own billing department of 40 people to make sure that my subordinates were doing okay, and I can spot in the system, like using these dashboards that I would make for my CEO and CFO, to figure out if, to spot the spot fires that were growing, to go, oh, Sally Sue she's having some problems with these types of rejections, or she's not processing claims in time or something like that. So I just kind of parlayed all those skills into creating this interactive dashboard that I use to visualize all the VAERS data and of course keep it current.
Right. So interesting. So you're from the medical billing field, so you know a lot about how all that works with insurances and also with Medicaid and Medicare probably. And you said that you were skeptical about these new warp speed vaccines that were being developed. But tell me, why were you said that you were on it on the very first day of the rollout of the vaccines. Why?
2020 was very, very suspicious for me. I actually thought that it was a scam, that something was going on in the scam, the lockdowns, the virus. I just thought it was a scam. And through that whole 20, when we were under lockdown, I would, I was going around at night, walking around at night. I wasn't afraid to walk around. I ended up driving to my local hospitals when they said, oh, it's packed, it's bursting at the seams with sick people. And I would drive down to my county hospital, a couple miles down the street, and plant myself for 4 hours at the front door, just, in the parking lot, watching to see the activity. And I was seeing the same thing on YouTube videos, following these channels that were doing the same thing in Los Angeles. They're going, look, there's a line of ambulances outside these hospitals. It looks like it's full. They got these big white tents at the entrance, so you can't really see. But you don't see a lot of people going in and out. You don't see a lot of ambulances coming in and out. You see a lot of line of ambulances parked, but they're not moving, and there's nobody going into them or coming out of them. It's just like a big prop. So plus I knew a lot of people in the hospitals, and they were, the nurses and stuff, and they're going, we're empty. We are empty. And the news channels in San Jose saying they're full. I was very familiar with our county dashboard, Department of Health dashboard, and they were saying that they were full, and it just did not jive with me. And so I had to check for myself, and that's when I realized I was exposing at that time in 2020 my county hospitals dashboards and going, look, this is not, this is how they were doing occupancy level of the hospital and saying that the occupancy level was like at 95% and it was at critical mass. And then when I read the fine print, which I had since deleted, occupancy level was dependent on the ventilators. They were saying that we had 1,000 extra ventilators in the basement of the county hospital, not even in use, but it had to do with when you have a ventilator, a bed connected to a ventilator, it takes a whole extra amount of specialized nurses. So when you're on a ventilator, and I know this by the revenue codes for my billing, it takes 7 specialists, physician specialists, to manage a bed with a ventilator, an anesthesiologist, and all these 7 specialists. And so it was dependent on staffing. And if they could only staff, 50 beds, then it came out to the occupancy levels at 95%, even though they have 2 or 3 floors completely empty or just not capable of maintaining that many beds with a ventilator. But that's how they did. That's how they were able to say that they had 95% occupancy, because they only had like enough staff to man, 20 beds or whatever with ventilators in them. And so that's
very strange.
Yeah.
So what about the beds that didn't have ventilators? I mean,
well, when we were looking at the COVID stuff, that was the part of the of the dashboard that they didn't show you, is like, well, how many total beds do you have in Santa Clara County Hospital? Let's call it 2,500. They didn't tell you about how many beds were actually excluded from this overall COVID jab occupancy.
And Albert and Cornelia, listen, if you look back on the timeline, that's all anybody was talking about. And as soon as it started to be exposed that many people really weren't sick, for months and months and months, that's all we talked about was COVID. And on the news, it was the COVID deaths, and it was the graph and the chart, right, with all this fictitious data that they were presenting. And that's all they were talking about day after day after day. And then May 25th, 2020, George Floyd happened.
Yep.
And that's
right.
And then after George Floyd, there was no more talk about COVID.
Yeah, that was Memorial Day weekend of 2021. I remember it well.
No, 2020.
2020, yeah, 2020.
Sorry. May 2020.
And also, Albert, I just interviewed Cece Blakeman from the COVID-19 Humanity Betrayal Memory Project, and she interviewed, they built a database of about 1,500 people who either died from hospital mistreatment or from the COVID vaccines. She herself interviewed about 150, and I went through the cases and I talked to her, and what you read over and over again is that somebody comes into the hospital, into the emergency room with COVID, and it's not a really severe case. And of course, a lot of them would be sent back. But let's say you come back because your oxygen level dropped, but it's still, maybe you have like 87% oxygen level or something like that. And they would put people, once they admitted them to the hospital, they would put people on ventilators. They would intubate them, whether they needed it or not.
And then give them remdesivir.
And give them remdesivir, exactly. So a lot of the COVID patients in the hospitals probably were, in fact, on ventilators. I don't know how many hospital patients there were in hospitals with COVID that were not on ventilators. We just don't know at this point. But that is another shocking, very interesting detail that you just revealed there with the 95% occupancy rate, which only meant that they might have had like 50 beds with ventilators because they didn't couldn't do more. Thank God. Imagine they would have been able to use all the 1,000 ventilators they allegedly had in the basement. And then they said, there we go, 95% occupied.
Yeah, we had an interesting thing happen here in Santa Clara County because we're a big county, a lot of people, and those 1,000 extra vents, they had some of the small outlying towns around here, Gilroy, Morgan Hill, just around and about within about 100 miles or so. They would keep track of like the amount of ventilators Santa Clara County was loaning out to these small towns.
They did it all over America. They sent our ventilators to other countries.
Yeah, so they kept track
with their issue.
Yeah, they kept track of that stuff, and it just wasn't making sense by my human eyeballs going out and looking at my own. I visited all my hospitals in around me, even Stanford, to see. I wanted to see the carnage that I was seeing on TV that they were talking about, and then plus I was calling around because I knew a lot of people calling around, and nobody was full. And
that's what the nurses were dancing.
Yeah. And then, of course, very first thing, if you remember Princess Cruises that came in, the port of Oakland, like a cruise ship came in, and they made a big spectacle of that where, it took them like 2 weeks to offload the 3,000 or 5,000 passengers that they had on the ship because they had to, they put the passenger in a hazmat suit.
And they wanted to isolate them.
Walk them out like 10 at a time. And it took like 2 weeks for them to get them off the ship. Right. A total show. In hindsight, it was a total show. But that was like the first thing that was like, Corona is here. So anyways, that's why I went on to VAERS, like your original question. And I was skeptical, and I go, this isn't going to be, I don't think this is going to be good, but we'll see.
Yeah, well, that makes sense. I mean, so you realize the pandemic isn't a pandemic. And there's something weird going on. Seems like it's more like a scamdemic than a pandemic. So that, of course, led to you feeling very skeptical about this entire warp speed operation and what would be the result of that. Okay, let's talk about VAERS. What is it? How does it work? What's its purpose? When was it founded? Why was it founded? Who manages it? All these things.
Okay, so the acronym stands for Vaccine Adverse Events Reporting System. It was a creation of that originated from the 1986 Vaccine Children's Injury Act, where they in effect gave liability protection to the manufacturers. That was Ronald Reagan in those days, and that's when people like Barbara Loe Fisher, who was kind of on the scene at that time, Phil Donahue show. She didn't come on the Phil Donahue show. Did Marge Grant did? But anyways, that was the whole time. And one of the obligations as a trade-off to the liability protection was the creation of this pharmacovigilance system we now know as VAERS. So it's an obligation by manufacturers and the government who's administering it, the FDA and the CDC, and by association, the HHS, to ethically maintain this system, this reporting system that is considered self-reporting, and that anybody can send a report, submit a report. However, in the details, it turns out that it's very consistent that about 85% of all the reports submitted to VAERS are filed by a healthcare professional not related to the patient, to the victim, to the registrant, whoever that person is. So they're healthcare professionals like doctors or hospitals or county health departments, or the manufacturer themselves who submit a lot, like almost like a majority of the are coming directly from the manufacturer because
That's interesting. You said the majority of the VAERS reports come directly from the manufacturer. Which percentage?
For COVID jabs, I would have to say that probably 40%, 50% that are coming from the manufacturer directly.
So how would they know?
Well, if you go, because on Moderna's website, they have like a file your VAERS report here on the Moderna website and on the Pfizer website. You can file your report through there, and it's very disingenuous, because I know the regular person would probably not realize that they're not submitting their VAERS report through the CDC. And they probably think that this is where you go to file. If I had a Moderna jab, I would go to the Moderna website and I get in through there and file my report. Well, technically, you're filing it to Moderna, and Moderna is supposed to forward all that to the, of course, to the CDC. But yeah.
Oh, okay. So, that's very interesting. So, it means that, let's say I'm a doctor and I want to file a report because I suspect a vaccine adverse event, and let's say I go to Moderna and file it through there. So, does that mean that these 40% that you just said that come from the manufacturers are actually probably pretty much all of them filed by doctors, nurses, maybe even some, non healthcare professionals, but not filed by Moderna staff or pharmaceutical company staff?
Yeah, no, they've received it or tipped off or alerted. A lot of these hospitals, there's a setup, and I've researched it and saw it, and the CDC offers like bigger institutions and hospitals, anybody who wants to sign up to submit in bulk, to submit multiple reports at one time in bulk. So a lot of hospitals submit in bulk. In theory, a lot of county health departments submit to VAERS, and and manufacturers, they're submitting in bulk to VAERS. When it comes down to it, I don't think they're submitting onesies and twosies. They probably receive a whole bunch, get throughout the week, and then maybe once a week hit the submit button, but officially submit it all in bulk. I could tell that by the timestamps of the when the manufacturer does submit. There's a special dedicated field with the manufacturer's timestamp of when they received supposedly when they received the report from wherever they got it, from a hospital or from a patient, a family member, a family friend, or so however they're getting them. There's a timestamp in there that tells me roughly when they received the report.
Because it'll all it'll all be the same. It's a bulk submission.
Yeah, and I could see by the way they publish the reports, the way VAERS publishes the reports, it's almost like in a lot of spots they receive 10, like 10, 20, or at least published 10, 20 and issued a unique ID number, one right after another. Like you're 10, you're 11, you're 12, you're 13, 14, 15, and they're all come from Pfizer, and they're all COVID jabs, and they're all, from Minnesota or something like that. There's like a thread.
So how do we know that let's say Moderna and Pfizer and other pharmaceutical companies actually forward all of these received reports to the CDC, FDA, so to VAERS?
That's a darn good question, and that's what I keep harping about. And I wish I had it set up, because this is exactly what Bobby Kennedy said at my church on June 19th of 2021. I have it on my main page in my Twitter. It's a minute. I clipped the minute long clip of it. But Bobby basically said the week before, which is about June 11th, 2021, he had met with a group of VAERS adjudicators. He called them representatives, but when he said that they were processing the claims, that these are basically VAERS adjudicators that reached out to Bobby to tell Bobby, hey, there are reports disappearing from our queues. Now, however, the VAERS adjudicators are receiving them. You know, they're coming in from all over. Probably those manufacturers that you told me. You know, like how do we know we're getting them all? We don't, and VAERS doesn't know either. I don't think. But when they all get to VAERS, these adjudicators kick in and they make sure that it's not a duplicate. They didn't previously receive the same, Melanie's same report from various different physicians, or Melanie didn't submit her report also. Make sure things are not duplicate. And that's standard in any billing software. If I go enter in a patient, it'll ping me and go, oh, you mean this Maria Sanchez, in 1967? And I go, oh yeah, that's the one. It's in my system already. Okay. Computer, I don't even want to say AI can do that. A regular billing software does that for you. But after that, they vet and authenticate that it's supposedly not a fake or false report. And so these adjudicators told Bobby that 150,000 reports had disappeared from their queue, that they were expecting to come in each morning. They were saying that, and he said this in a minute. He said they would come in every morning and notice 10 deaths were missing from their queues that they were processing, on their list to process. And collectively, they got together before they went to Bobby to then tell Bobby 150,000 reports, not all of them death, but collectively. And I don't know how long that was, but I'm very specific about the timeline. That was basically a snapshot. And he said that to my church on June 19th. And he said, I spoke to them a week before. So I'm pushing it back to June 11th, which is around the same time, the very same time as the very famous, now a Dark Horse podcast with Kirsch, Malone, and Weinstein was all happening at the exact same time. That matter of fact, I had met Kirsch before the Weinstein podcast, and I was already in communications with them. And then when Kennedy did come to my church, I had asked Kirsch for 2 weeks, hey, are you coming? I'll book it for you. It's at my church. I don't want it to fill up. And he's like, no, I'm not coming. I can't come. And then on the day, right in the middle of it, Kirsch calls me up and he says, hey, what's your address over there? I'm coming over. Keep Bobby there. Like, well, I don't roll that way, but I'm sure he ain't going nowhere. It's a packed house. He's got to take a bunch of pictures at the end. You got plenty of time. That was the day that Kirsch met Bobby for the very first time, and I have that all on video at the end of that speech. So that was a very cool day. But so Bobby is basically saying, and I've spent 4 years vetting and authenticating, that VAERS doesn't even publish all legitimate reports received. So if they don't do that, I highly doubt that even the manufacturers are giving everything to VAERS. It's like it's like the Keystone Cops, the good cop, bad cop situation we got going on. But
Yes. Yeah, I mean, the manufacturers have a very strong incentive not to pass on all that information about what terrible damage their vaccines cause, right? I would think. So I find this whole setup very strange, that you would have the opportunity to submit your report, not just to this government VAERS database that is, I think, co-managed by the CDC and the FDA, but that you can also submit a report directly to the manufacturer that manufactures the vaccine. And when you do that, does it say that, is there an indication that this will go to VAERS eventually? Or how does it, I haven't looked at that. I've looked at VAERS, but I didn't know you could submit it to the manufacturer directly. What does it look
I
like?
saw the cover, and it looks, I mean, it's
Okay.
very confusing. You would think that that's just the way to do it, or one of the methods. I don't think the real, the normal person stops to think, is this the real place to submit a report? They just, assume or are told, or how they even find it. I don't know. I think that they maybe even given that at the hospital at the time, possibly, if you got to file a report, call some people I realized, when they asked, like, who do I call, and they would be given like a 800 Moderna number or 800 Pfizer number to call if they had a reaction. And then they started there with a phone call, and then were led to a Moderna website or a Pfizer website. But I have not.
Well, that's very,
jumped into the system, their system, like I have.
that sounds very devious. I mean, it's not like they are linking to VAERS. It's a separate portal. It's a separate entry. And they have the separate system where you submit probably the same. It's probably very similar, but it's still a completely separate way of collecting the data. And the data is first going to, let's say, Pfizer. And then it sits there with Pfizer, and it's up to Pfizer to transfer and forward that data to VAERS. And there's no way of knowing whether they do that or to what percentage of, they do it.
My VAERS my VSafe never transferred mine to VAERS.
That's right, as they're supposed to do, right? Because you check that box that you want to create a VAERS entry from your VSafe information.
To do it, they said, "Oh, well, we don't do that." Mm-hmm. I said, "Well,
oh yeah,
file this as a vaccine injury," and they say, "Oh, we don't do that here."
I know, shocking. But to come back to that website, you said, Albert, that the website on the manufacturers, let's say Pfizer, I don't know, Moderna, that it looks very similar, that they might even have a VAERS logo on there, which is very, I don't know if is that even legal to use that logo. And then, I mean, you would think that if it looks that similar, so confusingly similar, that they must have done that on purpose.
Absolutely.
They looked right.
Yeah, absolutely.
They did that on purpose.
And that's the thing about VAERS. When you come to stop to think about it, VAERS doesn't really have an official logo per se. It's just the letters in blue, in the specific blue, kind of a royal blue. I know the font is called Questriol. I know that, but I mean, there's no official logo. So even, I'm just thinking like a lawyer, how to slither my way out of, into plausible deniability. But I could see the manufacturer saying, what logo? We have it in blue too. And here's the words VAERS. That's it. That's what, that's pretty much all the CDC has. I'm not to say that they have a CDC logo, but they just have like a blue VAERS, just like the CDC has.
Okay. All right. So to recapitulate, you said about 40% of the reports come from the manufacturers, and we don't really know how many of these reports the manufacturers actually forward to VAERS. That's a big unknown, apparently. And I find it shocking that this is even possible to submit an adverse event report to the manufacturer, who is, it's like delivering the chicken to the fox and going out with the chicken into the forest and handing it over to the fox. I mean, it just doesn't make any sense. So, and then apparently because most of these reports come from doctors and nurses, so healthcare professionals, they have no idea that they shouldn't do that. They don't seem to be aware that there's a real conflict of interest here, or there should be a conflict of interest. Maybe there is not a conflict of interest, but there certainly should be a conflict of interest.
Yeah,
in the normal
I wouldn't
world,
be
right?
surprised if they're just instructed to, because I really think that, at the hospital level, at least, or emergency department level, or urgent care, they're told whether, either to submit here, how to submit it, don't submit it. They're like instructed. I don't think it's like, oh, at the nurse's discretion, oh my God, this person looks really bad. We should, I'm sure that there were a lot of people that developed an issue within 15 minutes in that 15-minute window when they just get the shot, and have a vasovagal, they pass out or have an anaphylactic reaction. And even then, I think generally the healthcare professionals and nurses were detoured from submitting reports right there on the spot, or somewhere later in the day, or have some kind of mechanism where they keep track of it. But I did want to go into the next phase, and kind of why I was so hot and heavy for Melanie when I realized that she hadn't submitted her VAERS report, because I actually I had some ulterior motives apart from just wanting her to submit. And that was because I know that when you submit a report, you instantly get a temporary ID, and the CDC, just to pile on to this, to how nefarious this whole process is, the CDC will not automatically respond back to Melanie when her report is finalized and the final ID number is generated, at 4 to 6, up to 4 to 6 weeks later, at least per their guidelines. So they will not tell Melanie. Melanie has to, after she submits the report, she has to send an official email to info@vaers.org. And before, in the beginning, it was info@cdc.gov. I mean, I used that email 20 years ago. That's like their generic email, info@cdc.gov. That's where I used to originally in the beginning of like 2021. But at least they updated that to info@vaers.org, where Melanie would have to say, hey, I'm Melanie. Here's my temp ID, which authenticates Melanie, because, nobody's going to have that except for the submitter. And then please give me my final ID when it's ready. That's the only way that they're going to let you respond to you. So when you think about it, on the CDC level, they know which reports that they've received have eyeballs on them, which ones that they need to respond to, and which ones they don't need to respond to.
Right, because you'll never be able to find your report without the permanent number, because they remove all your personal information.
And is that still, Albert, is that really still the case, that you have to send an email in order to get your final ID or your permanent ID?
Did this a couple weeks ago.
Yeah.
Yes.
Right. You did a couple of weeks ago. But I'm asking because I went to the VAERS website this morning and I pretended, as if I wanted to submit a VAERS report. And it says clearly there that they will send, if I give them my email address, they will send me my permanent ID, I don't know, within, a couple of weeks or something like that. It does not say, by the way, if you want to have some sort of an ID to track your case, you have to email us. It doesn't say that. It says you will get it.
That's a good one to let me go back and check, because I know that's the case, and I have still screen grabs where I read that originally that you needed to submit a formal email request for your final ID number. So if that,
which is outrageous, by the
Yeah.
way, that you should, the whole thing of getting a temporary ID that is then replaced by a permanent ID doesn't make any sense whatsoever.
yeah, because they can't.
And you also said, but you also told me that the temporary IDs are then recycled later on. You know, you get let's say Melanie gets a temporary ID, and then once she has her permanent ID, they take the temporary ID and give it to someone else. So that will lead to great confusion.
Yeah, I mean, the ID itself is very simple. It's just all numeric. So the temporary ID number, for instance, Melanie, I don't have it off the top of my head. I do have it here.
Yeah, I'm looking at it right now. 1057888. They sent me my temporary ID on 5/24.
There you go. So it's like, what is it? So how's that? 1 million something, right? You said one. Read it.
05. It'd be 1,057,888.
Okay, so that is the same numbering system from 1990, the creation of if she were to go in to the VAERS official VAERS system and type in and say, what final ID number has the same as her temporary ID number, she's going to find somebody early on. In the 1 million, she's going to find somebody in the beginning of 2021. That's worth the video right there. It's giving me ideas to write stuff about in my Substack. But the point is it's not two different ID structures, alphanumeric or, a total different setup. It's exactly the same. And she got a new ID number, and that ID number was, what was it, Melanie? Like two something.
2842580.
Yeah. Basically 2,800,000 something.
2,842,580.
Yeah.
So your temporary ID number was way higher than your permanent ID number. Did I understand that correctly?
Way lower.
The reverse. Her temporary was way lower.
1,057,000, and my permanent is 2,842,000.
And that's because, Cornelia, all these when the manufacturer, they submit their bulk, or anybody that submits in bulk, they do not participate in this temporary ID system for the peasants, for the non-healthcare professionals that are submitting, the family members, or small clinics that are submitting the report one at a time. If you happen to be at an urgent care center or work at a hospital and you guys submit in bulk, you're not going to submit. You're not going to participate in this temporary ID system. I've always wondered, like, okay, let's say I work at the county hospital and I submitted it. Me as the submitter, how do I know what the final ID number is? And maybe my boss is saying, hey, Albert, that's not for you to even care about. I'm not paying you to care. I'm just paying you to submit the report. Did you submit it? You got your temporary ID? Good. Forget about it and move on to the next one. So there's, I could easily see how the nurse will not keep track of, like, the final ID number that is going to be created when the report is finalized.
Yes, exactly. I mean, why would they, right? There's no interest there. But I have a question about this whole bulk thing. So if you submit in bulk, maybe you submit, 24 reports on one day, and you get one temporary ID. Is that one ID for all 24 reports, or do you get one ID per report?
Well, what I'm saying is that that's a whole different temporary ID system that I don't know anything about. Those ones aren't, that wouldn't be like one temporary ID for this series of numbers that I'm talking about. Maybe you're given a different temporary ID for submitting in bulk, but I'm not familiar with.
And listen, guys, they didn't email me my permanent number. They send you an email an unencrypted introduction email, and then you have to click unlock message, and then it takes you to the VAERS website, and then there's where you get your message about your permanent. They don't email me any information.
Wow.
They just send me a button. Look, I can share it with you right here. Look at this is what it looks like. So right here, and look at who the email is from: pdvaersintdbo2@vaers.org. So let's go down the line here. So here's the day report confirmation. info@vaers.org is using Virtue to send and receive encrypted email. Okay, so there's the day that we submitted our report, and then the same day I request to them right here, please send finalized ID number for my VAERS report, temporary ID 1057888. And then right here, date completed, VAERS. So they copied my email that I sent to them. Then on the 24th, they sent me a message. And then on the 20th, again, let's see what it says, unlock message. Let's click this and see what it says. Right here, webwizard@icloud.com. There's report temporary ID. Here's the message I had to send them. And then they send you a one-time verification link. Then I have to go to my email. Then I have to go back and get that link. Then I have to come back here. Then I have to unlock the message. So it's this cat and mouse game to get these messages.
Wow.
And then the final one on 5/27, again, you have to go unlock message. You have to come back here. Then you have to get the verification email. And then they send you the message. So that permanent number is never emailed to you. You have to just go through this series of VAERS messages, and there is their logo right there.
There you go. That's interesting.
Okay.
That's not when I submitted my uncle's. It must have been more simplistic in May of 2021 when I submitted my uncle's, but they, in essence, emailed me back the final ID number, which after you jump through all these hoops of fire, Melanie, mine looked exactly like yours when you finally showed me the screenshot of yours. I go, that's like the same message I got, except I didn't have to jump through all these hoops.
And then look in the subject line. They did add it. VAERS acknowledgement. There's my final ID, 2842580.
There you go.
So in other words, they make it really hard for you to actually get your final ID.
Yep. Because I was even tricked. I'm like, what am I doing?
Yeah.
I do what? Oh.
Yeah, it's really convoluted. And a lot of people probably, why would you realize it? Because on the website, it says, on the VAERS website, it says that they will send you your permanent ID. And apparently, since you just did that a couple of weeks ago, apparently that is still so. So a lot of people never end up with a permanent ID, which means they cannot track their case because the temporary ID will be recycled. Who knows?
Yeah,
maybe
how would I
just in a
update
couple
it
of weeks.
if I have a death?
And you cannot update it. So it would be maybe you can access it through your name. I don't know, but that might not be easy, or it might even be impossible. I don't know. Okay, very interesting. So with this, one more question about these bulk submissions that are done by hospitals. How does that work, Albert? Do you have any insight into that? Is there, for example, a dedicated nurse at a hospital that is responsible for bulk submissions for VAERS?
No, I'm not familiar with that. I guess every hospital would be different. I mean, of course, on paper, that's what they make it sound. That's what they say. That's what it sounds like. It's like, but in practical application, I highly doubt. I haven't heard of any nurse really saying like, oh yeah, we have a system of submitting reports. Every time I hear of VAERS reports in hospitals, it's like the staff is either getting in trouble for submitting them or something. So I would not know. if I were, managing the front office or whoever's going to submit these VAERS reports, it's just like medical billing. It really is. If I were, allowed to do it, I would say, dude, let's when you have to submit a VAERS report, just run it through let the billing people do it. I mean, as long as all the data's there, it's just like submitting an insurance claim form, and that's what these guys, do all day long. But okay, so granted, I highly doubt physicians are submitting them. I think they delegate it to the nurse. Hey, submit this. We need to submit if they even do. We're getting some. We're getting, so they got to be coming.
So you just said something really interesting, Albert. You said they are getting they might be getting in trouble for wanting to submit. Why would that be?
Oh man, that's like Deborah Conrad in over there in New York. She took it upon herself. I don't know if you're familiar with Deborah Conrad, but she was basically a hospital a nurse, I think, and she took it upon herself in her hospital to submit these VAERS reports, not only for her own personal patients, but for other nurses or others that she wasn't necessarily like the nurse of that, of that patient, but in the hospital, the same hospital. And I think she submitted something either like about 80 total reports, 80, 90. She's got a court case now. Now she's suing, and Warner Mendenhall is her attorney. But she ultimately was fired. But leading up to the firing, she was told at first, like, no, you can only submit reports for just your patients, not the other doctors or the other nurses or somebody that you happen to know, just your official patients. And then that escalated up to not even that, and for found whatever reasons they needed to basically fire her for submitting these VAERS reports. So
I remember that case now. I remember, and she said that once it became known in the hospital that she knew how to submit these VAERS reports in an efficient way, because it's not so easy and you have to learn how to do it. Doctors would come to her and say, oh, I'm overwhelmed with this and I don't have time and it would take me forever, but you know how to do it. Can you please do it for me? So she had that reputation of knowing how to quickly and efficient and submit these VAERS reports. And that's why she submitted so many. And, that was the reason. And I remember that. You're right. She got into trouble for that. Also, Melanie, you mentioned in your own case how you were told that we are not doing that here. So it was known that this is something that it's not being done here.
Well, and you have to, from start to finish, you have exactly 20 minutes. Albert and I put a timer on a stop clock, and we got it in about 19 minutes and submit. And we had everything already bulk ready to copy and paste in, and it still took 19 minutes. So,
but to be told by someone at a hospital, was that at a hospital where you were told that we are not doing that here?
Oh yeah,
yeah. Okay, so to be told something like that, there must have been
that I these afflictions that I had have to be from the vaccine, because every time I got a vaccine, I got another affliction. And I would ask the doctor. I said, "Well, are you going to file a VAERS report?" Well, because I would ask them, I would say, "Well, do you think this is from the vaccine?" And they're like, "I don't know. I mean, could be." And I said, "Well, are you going to file a VAERS report?" And we don't do that. We don't do that here. You have to go to the place where you got the shot.